welcome all. I think this is really a distinguished panel, and my job was made easy with Dr. Ofrin by setting the stage and identifying the key areas where we really need to put our thoughts together in the next 45, 50 minutes. And then we will have a 10 minutes at the end of the session for question and answers. I remember 5 years back, when we started DataLEADS as an initiative of bringing different thought leaders together, our challenge was people were saying, why are you focusing on health? As a media company, it made no sense in 2015 to build platforms around health and bring scientists, doctors, technologists together. I remember one of our very first workshop, it was a group of 20 health journalists and editors and 20 doctors in some part of India, in a remote part of India. And people were saying, why are you bringing these two different set of people together? But I think the biggest learning from COVID was actually that the future is in collaboration. You can't be a scientist and have your own universe. You can't be a policymaker and have your own universe. And you can't be an investor and have your own universe. I think when people come together and they are integrated in their vision and in their approach, solutions happen. We're going through unprecedented situation. And we're all aware of it, the loss, the suffering, the challenges we faced in the last, actually now almost 2 years. So if I start with my panelists, actually essentially identifying where do we all stand actually after these 2 years of unprecedented healthcare crisis, and what are our major challenges at the moment, looking at the next 1 year or so, and is there any kind of opportunity which could help us to overcome the challenges? I will request Dr. Srinath Reddy, if you start first, we do a couple of short, I will give a chance to each speaker to make a quick opening remarks, and then we proceed with the rest of the session.
Thank you very much. As has been very clearly pointed out by Dr. Ofrin, we need an all-weather health system, which is seen to be efficient and equitable in the steady state and can provide a swift and strong surge response when challenged with a public health emergency. And the agenda for health is very vast, but has been clearly defined already. We don't need to fully reimagine the agenda. We need to reimagine the path to the realization of the agenda, because we already have it in our National Health Policy of 2017. We have it in the Sustainable Development Goals, which are very clearly charted out what needs to be done. Now, we have to draw the lessons from COVID and move on in order to ensure that we actually achieve all of those objectives. And for that, I believe primary healthcare-led universal health coverage is going to be the key pathway. The importance of primary healthcare cannot be overemphasized in terms of whether it's rural or urban. It has to be comprehensive, continuous, deliver acute and chronic care. It has to be community-centered, but also connected seamlessly to other levels of care in a bidirectional manner, be it district hospitals or strengthened medical college hospitals. So essentially, we do require strengthening. But all of that is not mere infrastructure. It is health workforce. We do need a multi-layered, multi-skilled health workforce in order to make that system much more efficient and capable of delivering. And since we are also running against the clock, while we do invest in medical colleges and nursing colleges and allied health professionals, preferably at strengthened district hospitals, also emerging as training centers, we need to use technology-enabled frontline health workers, the primary healthcare workers in both rural and urban primary healthcare, very, very clearly. And that is going to be one of our early priorities as we move along. Then, ensuring that essential drugs and vaccines are available at affordable rates is going to be a key element, because if one of the objectives of UHC is to reduce the financial burden and out-of-pocket expenditure, then supplying quality assured generic drugs across India is going to be absolutely important, both in the public sector and the private sector. then we do need to ensure that we have an agenda that's not restricted only to communicable diseases and maternal and child health, which are very important carryover from the Millennium Development Goals, but address the complete agenda of non-communicable diseases, mental health, substance abuse, road traffic accidents and road safety, all of which are connected, and connect the health system also to the social determinants of health, because health does not function in isolation, and it is determined by policies and actions and many others. So let me say that what we really require is also a people-partnered public health and data-driven, decentralized decision-making at the district level. And it's not just reimagining, but also reconfiguring, and as Dr. Offren said, realigning and realizing that entire mandate. Thank you.
Thank you so much. Dr. Yasmin, let me come to you. How do you see, what was your key learning from the last 2 years, particularly when it comes to women's health and children's health?
So first of all, thank you for inviting me to be part of this panel, because it's so important that we continue to echo a lot of the messages we've heard from Rodrigo and from Professor Reddy. It's not rocket science. While the pandemic has shown us where the fault lines in the systems are, and I'm not just talking about the health systems, it's health, nutrition, all the elements that lead to people being healthy, that we have discovered where the fault lines are. But we've also seen where we need to focus more. And that goes to it, that we have to reinforce our the evidence that is there, and the practice and the policy that is needed to take it forward. Now, if I look at what are the opportunities that we have been shown, that without availing those opportunities, we have not been able to take the response to the pandemic to the level that we have, we need to focus on a few areas. And Professor Reddy and Rodrigo have mentioned them, but I want to reinforce them. One is primary healthcare. That focus at the community level, at the level that is closest to the community, is crucial. And it's not just about medical treatment, it's about working with communities, the preventive, promotive, and curative side of any health issue. And it's not just one ministry or one focus area. It's about our health, nutrition, water and sanitation, public information, panchayat, local action. So there are a lot of the elements that need to come together. And I think the pandemic and the response has shown us that we have to focus more and strengthen it more. The second area is that of how is the community involved? Are they passive recipients of information, or do we need to engage with them? And that has shown crucially that it's not just about having a banner and a poster or giving out jingles or just giving one-way information. We've found that when it comes to critical behavior that needs to change the course of the pandemic, which means masking, hygiene, and distancing, plus, very importantly, vaccination, unless we have a two-way communication with the community, they are not going to be convinced of the value, because it's individual and collective action that is needed. I'm not just taking a vaccination or wearing a mask for my own protection, it's mainly to protect my community also. And that sense of community has to be strengthened. And it'll only happen when we listen to what people are perceiving, we listen to what they are fearful about. We listen to what will help them adopt the behavior that is being promoted, for which we have the evidence that this behavior does make a difference. But it's also to look at where are the gaps. And it goes to Dr. Reddy's point about evidence. If we look at the evidence that's out there on even vaccination at the moment, we see that 45% of those vaccinated are women. So we are seeing a gap in the vaccination even of women. Why? Is it linked to some misconception, or is it just that women are not getting time from their household work or it's a transportation issue. Why are women not going for vaccination? So these are questions that we've asked ourselves in child immunization. It's not reinventing the wheel. It's really learning from a massive, successful vaccination program for children. But adults are more resistant to behavior change. A child for themselves.
Wonderful.
When we look at adults being okay with their child being vaccinated, but themselves seeing a needle creates a lot more tension. So it's really about understanding that and looking at asking people about it. The behavior surveillance side of it has come in very strongly. The third area I would focus on is mental health. This across the board, whether it's of people, communities, teachers, health workers, everyone who's been involved in the pandemic, there are mental health issues which need to be addressed. And it's not just through the health system. It has to be through the various elements that are in place. So big shout out for mental health. And the final area I would say is that we do need to have a special focus on girls and women.
Wonderful.
And any strengthening has to take that into account.
No,
Thank you.
I'm actually quite glad, that we're having the same ethos. It's about identifying and moving forward. We don't need to really reinvent a lot of things. Maybe we can look back at the evidence, and that takes me to Dr. Shahid Jamil about the role of science. And everybody is looking at evidences and numbers and data. Shahid, what's your big learning in the last 2 years as a scientist, as a virologist? What do you think is a big learning for us here?
Well, Nazakat, firstly, thank you for inviting me to this really august panel. My biggest learning is also a challenge, has been a challenge and will continue to be a challenge, which is that pandemics are controlled with trust. And trust comes from transparency, and transparency comes from truth. This whole cycle of truth, transparency, and trust has sadly been missing. But let me focus on two things that I possibly understand a little better than the other things. That's variants and vaccines. I mean, Delta is the flavor of the day. But let's not forget that viruses will continue to mutate. Viruses will continue to change if we give them the opportunity to change. And all that goes back to behavior. We worry about this variant or that variant, but we resist wearing a mask, which can prevent all variants. When Delta was first seen in Maharashtra, it was December 2020. And we saw that it very quickly emerged, and by February, it was already spreading. And by March, it had started to compete out other variants like Alpha. So Delhi is a very good example of that. Both Alpha and Delta were spreading in Delhi, and Delta just overtook the Alpha variant completely. That should have been a warning bell that this is something serious going on. If you look at the data now, 100% of virus, almost 100% of the virus circulating in India is Delta. Greater than 90% of the virus circulating globally is Delta. In India, we saw a surge coming up in March. The rest of the world, the surge started somewhere around May. The point is that viruses will get around. You may have shut down international flights and you may have shut down tourist visas, but viruses will get around. Possibly the biggest achievement of this pandemic has been vaccines. It used to take 10 to 15 years to make a vaccine. It now took less than a year to make vaccines. And believe me, in future, all the same people who are criticizing that COVID vaccines have not been tested enough will demand the next vaccine in 2 months or 3 months' time. So science plays a role, technology plays a role, And I think we need to build the trust that these vaccines are good and safe. You know, the data is all there. To me, there are three challenges for vaccines today. There is challenge of access, there is challenge of equity, and there is a challenge of stupidity. You know, we are not making, although vaccines have been hugely successful, there's not enough to go around. And because of that, there are parts of the world that have less than 1% people who are covered. On the other hand, there are other parts of the world that are already talking about giving a third booster shot to their populations. So that is a matter that needs to be seriously considered. And of course, you can't really do much about stupidity because, you know, there are people who say that I just won't put anything in my body. So this is as much a pandemic of the unvaccinated is becoming one. And this is something that we'll have to deal with. Finally, I would say for India, I think going forward, one very big challenge, although India is considered to be the pharmacy of the world, one very big challenge for India remains the import of active pharmaceutical ingredients. You know, in the early 90s, India imported only 3% of APIs. Today, India imports greater than 80% of APIs, and mostly from China. So if China shuts down or China decides to cut off, you know, sending APIs, Indian market will not have paracetamol. So, you know, this is a very, very serious challenge. And I think this is as big a threat to national security as anything else. And we must pay attention. Let me stop there.
Thank you so much. Thanks a lot. I think, Dr. Shai, you really identified the things really well, and we will come back again one after another to discuss these couple of very critical issues. I think the pandemic also put a lot of focus on technology, the role technology can play essentially in delivery. I think I was having a chat with one of our speakers yesterday, and he also helped to identify it was not really the shortage of oxygen. It was the shortage of logistics which can deliver the oxygen. So I come to the Mr. Kumar, you're a technologist, you run a technology company which provides tech solutions. What is your learning out the last 2 years? How do you see what was one major takeaway for you as a technologist in terms of role of technology in public healthcare, delivery? Dr. Kumar, your speaker is off. Yes.
Thank you very much. The point of one major point, what is observed. In fact, all elite experts are there in this panel, specialists, doctors, professors. But me as a technologist and looking from outside, the major difference what has been seen is that probably earlier, before the pandemic, a person goes to consulting or diagnostic center or hospital. Now it is all different. Identifying the person, I don't want to use the word patient, but let us say a person who is infected, identifying contact tracing, and then how to contain that further expansion, and then how to prevent it. And for that, it requires a lot of data. So I'm just giving one example, let us say the technology. To what extent, I'm not going to say about whether it is really being used by entire population or no, but if I just give an example of technology usage, Arogya Setu as an app. Instead of somebody going and collecting the data, individual can give the data. And within 50 meters, within 100 meters, within 1 kilometer, 2 kilometers, how many people are using it, how many are infected. And using this data, we are talking of almost like 130 crore population. If you are talking of only India, 1.3 billion population. So big data is huge to monitor, collect, analyze, interpret, and then predict. So without technology, this is not possible to identify where it is going to happen, predict. We heard probably, you know, the professors are here, they are aware probably, but for me, it is like, you know, the red zone, hotspot. Okay, so all those things are first time we are hearing. Okay, how to identify those areas, contain that. So without technology, this is not possible at all. Great. And prior to pandemic, probably the point of using technology, I'm not talking about technology for diagnostics, machines, and all those things. I'm confining to the business process, technology for business process, efficiency improvements as part of YASH and SAP offering these business solutions. If I see probably before the pandemic, the more focus on optimizing the business process. A lot of healthcare organizations have invested a lot of investment on technology improvements and adoption. Probably some organizations may be using primitive solutions, but the focus prior to pandemic, my observation was that it is basically on R&D, manufacturing, distribution, the diagnostics part, hospital management. So this is more of a focus on business process. Now it is all totally changed, and the technology is required either from the apps point of view, which should be available to the individual, a person, and data processing, prediction. So huge technology is required here, and artificial intelligence, machine learning. I'm not getting into the details of those jargon,
Right.
but it is very much required now, and people are observing that it is very much required, and people's expectations have tremendously increased.
Thank you.
They want faster medicine discovery. They want faster distribution. They want production. They want production, adequate production in very minimum time. So these expectations have increased tremendously, and it requires a lot of business process automation. And that is where I see the technology coming into picture.
Mr. Kumar, let me take that decision to Dr. Sujai. He is a leading, like a data, you can say, initiatives at one of the biggest hospital chains in the country, Apollo Hospitals. Dr. Sujai, how was data helpful during COVID for your hospitals? You are very much into the operations, very much looking at numbers. I went through your research yesterday. It's phenomenal how you collected data from 6 Apollo hospitals and tried to make sense of it. If I ask you, what was the one single learning as a data scientist during the last 2 years?
Thank you very much for this opportunity to come and talk about this in a very distinguished panel. I would put it in a very different way and want to take you all to 2040. That's what we are talking about, right? How we are reimagining 2040. And if we are at 2040, we will see 2020, 2021 as somewhere we recalibrated our entire health system. And that came through a virus. Shai Zamin sir will understand it better more than me, but that came through, the impetus came through a pandemic of that sort. But if you look at it from the data perspective, and we don't collect only from 6 hospitals, but we're looking at 74 hospitals, and we are now using this data, federated, meaningful, in many ways in building these models to actually predict diseases and use them prospectively in our systems. I think we have learned 4 or 5 things at the moment. First, there is a new imperative to process real-world evidence and learn what we didn't know prior. So this is very important to understand that what we knew and what we are coming to know, there is a difference, and we must understand and adopt that. And then the second thing is this, that I was hearing to all of the speakers prior. One of the things probably we are missing out in all of these is the burden of non-communicable disease, which has had a profound impact on the pandemic. And the pandemic would have an impact on these on a long term. And therefore, the longitudinal patient data is going to be very, very important in analyzing and understanding the patterns as to how we take this forward. Then there is something that we work very extensively with, which is called the opportunities for the data validation. So today, if you look at the data privacy laws across the different countries, possibly I'll not be able to go and share the data with my alma mater at MIT and ask them to build models. So there are some ways by which we are looking at federated learning, using cloud computing, using something like homomorphic encryptions and others, where I do an extensive research with Microsoft, Google, and others to see how we can work from a computing perspective on those data sets that align with that. And the last 2 points that I want to make is, there are certain changes that we are going to see now more and more often by 2040, where the genomics become a very mainstay of how we are going to look at the entire analytics piece and patient profile. And lastly, because of the digital changes that we are seeing and giving so much of power to the patients or to the individual, we would need to now change the way we have collected data. And it comes from the patients in a decentralized approach. And Srinath sir was also talking about it, where we are now more focused about what we call as patient-reported outcomes. These are fundamental changes that are going to happen at the level of the individual, at the level of the clinician, at the level of the community, at the level of the people, the tech providers who are coming in and doing that.
Wonderful. Anjali, I will come to you. You have years of experience working on ground, working with policymakers and working with a lot of other organizations. What was your learning in terms of how to bring people together, how to build collaborations? What do you think was your main learning actually in the last 2 years?
So, normally it's tough to be the last speaker, especially when you're in a panel with such eminent speakers. Most things have said, but I will try and respond to your questions. So first of all, thank you so much for inviting me here. And I think as I sit here and as I've worked with communities across countries, because I look at Southeast Asia and across the continent of Africa in my current position, is that it really, really defines what a good friend and colleague, Dr. Madhukar Pai, recently said. He said, we're now closer to seeing the end of the pandemic. And what's really going to decide how we reach the end of the pandemic are two things. One, of course, is the variants, which we have little control over. But the other is the inequities. So one of the things that's been my big learning during this is the inequities. They were always there, but they've just surfaced so much more. And I'm the perennial optimist, and I do think that the world will recover. Some regions more slowly than others, but I'm hoping that the world will recover steadily. But it's not going to happen without collaborations. It's not going to happen without partnerships. It's not going to happen without sharing learnings. And this is where all the challenges, resilience, the strategic ability and entrepreneurship, these examples that have happened across countries within the states of India and the neighbors are shared transparently and honestly. We also, the second thing that I've really seen is, and I'll come back to the equity or the inequity point again. The second thing that I've really seen is when, yes, this is a crisis, but as Professor Reddy said, it's also an opportunity to not just yes, reimagine, but before that, even build back. There have been disruptions, and we know that we have lost years of progress that was made. And we need to build that back as we reimagine, and we cannot do it unless we address the inequities. So let me just give you 4 quick points. The disruption to the services. We know there were disruption to the services, to the emergency, and the government was quick in categorizing certain services as emergency services and saying they should be there. But people couldn't access them. If immunization was disrupted, it was those who couldn't access services, those who did not have the ability or wherewithal to access services. If maternal and child health, family planning, reproductive health services were not accessed, again, it were the marginalized and it were the economically weaker section. Services like cancer care, the Delhi Cancer Hospital shut down. Tata Cancer remained open, but people couldn't travel during the lockdown. And that, again, sets us back. Gender issues are tremendous. Nutrition has been impacted with close down of schools. We know we are going to, when the data emerges, we know we are going to see a lot of problems. So to me, there are three very quick solutions. One is that we need to localize our efforts.
I will come back to you about solutions in the second round. So I will. Okay. So we had a overall and this like a little understanding here. Okay, what was wrong? What could happen? Let me move to the next session. and I will try to do it a little faster, and then try to figure out if we look at now, say next 5 years, immediate next 5 years. So I will start with Dr. Reddy again. There's a lot of debate globally that there's a preventive medicine, it will play a fundamental role in the future. Keeping people healthy, then treating the ill will be the strategy moving forward. And I'm glad you already mentioned in the opening remarks. So how do you see that role of preventive medicine in the future of health? Or do you see there are a couple of other key areas where we need to really focus, immediate focus of next 3, 4, 5 years?
I believe preventive medicine is absolutely important. When we talk about prevention, actually, it covers many areas. It covers firstly health promotion, keeping people healthy in the first place so they don't acquire the risk of disease. Then secondly, prevention involves detecting the risk early and correcting it as soon as possible. And also providing certain services which are likely to prevent assaults on health, whether it's vaccination or other elements like that. But it also requires prevention across the life course. Even people who have acquired a disease or a risk factor can be benefited by interventions which reduce the level of risk and preventing diseases from occurring again in an exacerbated fashion, even once they've manifested clinically that they've had an event. So prevention is right across the life course at various levels. And therefore, preventive services become absolutely important to everybody, right from the even preconception time to the birth and then across the other stages of the life course. So if we actually build in that into our health system, and also, as Yasmin said, ensure that the social, environmental, and commercial determinants of health are also configured in a manner that prevention and health promotion become eminently possible and affordable for everybody, both through population level policy measures as well as health system mediated personal protection measures, then we'll be able to achieve prevention really across the life course. And that is going to be the best investment we can make in the health of the country, both because it also has intergenerational benefits. If you create a good food and agriculture system, if you create smoke-free public places, if you create pollution-free transport systems, it's not only this generation, but the generations to come will benefit from it. And therefore, the intergenerational benefit cannot be discounted really.
Right. Yasmin, if I come to you, and please feel free to raise your hand, make intervention, add your thoughts to any panelist. It's absolutely like, we keep it open. And Yasmin, if I come to you, when you look at the investments into the health systems, particularly dealing with the women, how do you see actually, like, what are the things we really need to do in next 1 to 2 years to improve the health systems and dealing with the, like, different, health interventions, particularly for women and children?
So there has been a huge investment, and we've seen the result of it. If I just look at, say, delivery in health facilities, pre-pandemic, now it's a bit different as the data, but pre-pandemic, we had reached about 80% women delivering in health facilities, which is massive. So the investment is in the infrastructure, it's in the training, it's in the creating more demand around it, creating the trust for women to go there. It's also meant investment in some form of support to the family if the woman has to leave the house and go to deliver or give birth in a health facility. So the schemes that have been put in place for that have also added to it. Now, we need to look at what else is needed. And also, when we've invested in it, are we getting the full outcome of it? And I think that's where we need to hone in. For example, 80% of women do deliver in facilities, but only 60% are starting breastfeeding in a timely and exclusive manner. Mm-hmm. So there is a gap happening there. Are they being treated the way they should be? Are they being counseled the way they should be? Definitely, we need to be doing more. And that's just on one parameter. When we look at women availing services when they face violence, And I think this is one that has really come up during the pandemic. When you're facing violence, whether it's physical, verbal, or mental abuse, where do we go? How is the health system responding? And that's an area which remains gray. What about our frontline workers who are women? Are we addressing their needs and support to them so that they can be most efficient in their work? We need to ask ourselves that question also. So there's still some areas that we haven't explored enough.
Right. If I go to Dr. Shahid Jamil, to you, the solution also lies actually in research. Like, what is the research available to us which guides our decision making? And India has a huge, a promise in a biomedical research. But what are the challenges you are seeing in the next, moving forward? What are the challenges in the field of research, medical research, biomedical research?
Well, obviously, the first challenge is to have enough funding and sustained funding. Innovation doesn't happen in a vacuum. We talk about the success of vaccines, and we talk about how RNA vaccines have really changed this pandemic. But RNA vaccines didn't happen overnight. They are the result of over a decade of research to use RNA as cancer vaccines. And people were smart enough to realize that there is a low-hanging fruit here. Let's apply to it. And it worked. I keep saying that we are very lucky that COVID vaccines have worked as well as they have. The same principles applied to HIV vaccines haven't worked. Sustained investment in science is very important. The other is that, when you have sustained investments, you will begin to look at things in a more proactive manner rather than in a reactive manner. Can we begin to address, for example, what is going to emerge next? We possibly won't be able to predict when it will emerge, but if our screening systems are good, we may be able to predict what might emerge. And if we can predict what might emerge, can we have diagnostic tests and vaccines ready for them when they emerge? But all this will require funding, all this will require preparation. I mean, I was intrigued by something that Sujoy said, that they are looking at data from 74 hospitals. Now imagine if this longitudinal sampling of patients that they're doing from 74 hospitals in India, if we have a database that tells us what those blood tests tell for the community, then we should be able to tell very quickly if there is a sudden spike in something. That's the early warning system for a pandemic, for an outbreak, for an epidemic, not just a pandemic. Just one last example, and this is, Sujay, something that you should look into. Fevers of unknown origin come to every hospital. We call them as viral infection. We don't know what we mean by a viral infection. We have the technology today, and the technology is inexpensive enough to be applied to it. But we have to, set the systems to begin to apply it. If we do that, I think we will switch from a reactive mode, as we have done now, to a proactive.
Sujoy, thank you so much, Shahid Jamil. Sujoy, what is your priority at Apollo Hospital in terms of data and using that data for better responses? Like, what is your immediate thought process and a thought process of your team in terms of using data for better healthcare at hospitals?
So there are a couple of things that we are actively looking at. And as Shahid Jamil just said, when you look at the longitudinal data for whether it is for any infective conditions or for non-communicable disease, you are finding in certain trends which would be important for not only primary prevention or primordial prevention, but also from the secondary prevention, and also pushing in the time for early complications by improving on what we call in a system dynamics language, average wellness time, and pushing in the effect of complication that happens. So
if I ask you this way, other way around, to make it simple for the audience here,
right.
are you hiring more data scientists in the future than the doctors for the hospitals?
No, I think it has to go hand in hand. I mean, you know, and this is a question that I'm often asked, is artificial intelligence going to take over from the doctors or the clinicians? The answer is absolutely no. But yes, people who use artificial intelligence or whatever form of machine learning and others will replace people who do not use it.
Let me take that to command to you as a tech company again. What are the products you're making actually for the future? Looking at now your experience of like a couple of decades, you have been IIT and all. What are the products you think will hospitals, will healthcare, public health, like for example, surveillance, the disease surveillance is a huge, massive area at a community level. Do you see there are new solutions which could help us to do better surveillance?
Perfect. In fact, you were saying about what we heard on the issue with the oxygen availability. So more than the availability, it is the logistics thing, supply chain. In fact, in keynote address also, we understood the importance of supply chain streamlining. So once we have a solution for it, we already have supply chain management solutions already there. So how to optimum distribution of available resources, understanding the need, and based on the need, supply whatever is required to ensure that everyone gets whatever is required. So the supply chain streamlining is one of the things which is very important, and the solutions are available. Supply chain management solutions are available. The other thing is about, we know now in this last 1.5 years, the expectations of people. Number one, very, very fast rate, short time. They need a high quality medicine. I'm not using the word vaccine. If we say vaccine, wanted at a very, very fast rate. I don't know earlier how many years it was taking for discovery or invention and then trials and all those things, but now people expected in months. And after it is available, there were apprehensions on the effectiveness. So there is a psychological impact on all those things. So high quality, people expect, and high volume, and at a very low cost. So this requires process optimizations and robotic process. In fact, Dr. Sujay was talking about artificial intelligence and machine learning. So these technologies are required, solutions are available. They're not going to replace the specialists. That will help and aid and increase the overall effectiveness.
I will go to the Anjali, but before that, Anjali, I will ask Dr. Shinadari a quick intervention, because there's so much talk about data-driven future, artificial-driven, intervention. In a quick word, how do you see the role of artificial intelligence, machine learning, data in healthcare interventions?
They can really address the complexity of multiple data sets that are required for getting an analysis of what the health situation is like at the population level and what are the determinants at the individual level, particularly in a situation which is likely to be changing fairly frequently. So to keep track of that, we can use it. However, the question is that artificial intelligence is based on algorithms which are very context dependent and are dependent upon the input data. Therefore, algorithms that are developed in a Western population may not be contextually appropriate to our population. Therefore, you do need our own data sets to develop our own algorithms and test them on our populations. So that is the important element.
Wonderful. Anjali, coming back to you again, we're talking about technology, we're talking about machine learning and all in the future, but there's a huge gap actually. The access to healthcare still remains diverse actually, and Dr. Yasmin talked about women health. The majority of women still in this country die at home because their health is not seen important and they're not even taken to hospital. When you look at the last data which the government released in the parliament, majority of women still die at home because they're not even taken to hospital. So how do you see that gap actually? It's huge in a country like India, a massive 1 billion people. What do you think one or two key points actually which could help us to bridge this gap in the next couple of years?
Yeah, thank you so much. And I'm also conscious of the time, but I think there are two things here. One is, of course, communicating, building that communicating to the community leaderships and building that infrastructure for them at the grassroots level to support these women. The second, if you're talking about technology, I see a great potential in telehealth and telemedicine. And I think that's where we need to invest over the years to make sure that services reach the poor. We can use telehealth, telemedicine, and technologies that go with it to get the services down there. And we do have guidelines. The government has come up with guidelines. I think more and more organizations need to invest in it. And I think there's one thing, Shahid, that I do want to point out. We keep talking about vaccines, and I'm glad you brought out the point about API. But I think at the same time, India really needs to look at treatment therapies. And the world is moving ahead. We haven't focused much on it, and we do have the capacity and the capability to do that. So I think if we want to do a comprehensive response to COVID, then of course, diagnostics and vaccines are absolutely critical. But at the same time, treatment therapies also are equally important. We don't have any at the moment.
Wonderful. Yasmin, if I come to you actually on a question about, looking at I'm discussing about the manpower, that we need doctors, we need, public health workers. Who will train them for the future? What kind of training they will require? We need a biomedical scientist for that matter. And I think we have a great panel here, which has a domain expertise in training and mentoring a new generation of, like the thought leaders and doctors. And what do you think? What are the couple of things? And I can ask maybe the recommendation of the all panelists on a quick note. What are the couple of things you think the future doctors really need to keep focus on when they go to medical colleges and then when they come out?
Having trained in a medical school myself and knowing how we go in with a lot of enthusiasm and commitment to serve humanity, somehow over the years that erodes. And I think finding ways in medical education, especially to keep the focus on the service element, that it's the humanity element of it, and the trust in communities, and how we have an obligation to build trust with individuals and communities. And I think given the India perspective, the public health perspective is huge. And we do need to strengthen our capacity at all levels in public health, because it's not just a one-on-one. It's not, our medical training doesn't necessarily prepare us for that. We do have to look at public health.
Wonderful. Dr. Shahid, I remember you in one of your interviews, you mentioned about how the young scientists actually even lack really basic skills, even facing medical, like a research paper and all, though despite we have a huge potential of scientists in the country. But sometimes it seems like is mentorship lacking, is they don't have a support system available to them, or they do not have a world-class facilities where they can really study and do really, deep dive research.
I think it's a combination of all of the things that you've said. But it's also really, whether you look at medical education or you look at the training of a biomedical scientist, it's the siloed education that we get in the country, where somebody has to decide after 10th grade whether they're going to do biology or do engineering. And there is, because of this, there is very little cross-disciplinary appreciation. And people just don't like to read outside their very narrow area. And I've seen, I've trained PhD students and I've trained postdoctoral students. And, the biggest challenge that I've found is to sort of impress upon them that reading outside your own very narrow area of work is of value. Your best ideas don't necessarily come from your very narrow area, but they come from outside your own area of research. So it's a combination on all of those. And I think the biggest challenge that we find at multiple levels, whether it's doctors or researchers, is the ability to communicate effectively. You can't communicate effectively to your patients. You can't communicate effectively to people who are listening to you present your research. And that's a problem. We don't focus enough on that.
Wonderful. We're having questions from the audiences, and I encourage whoever is joining us on YouTube, or my colleague Surabhi will help me with those questions. But I want to take this question to Dr. Srinath Reddy as well about the future manpower for the challenges of the future. Because Dr. Srinath Reddy, for someone who moved from individual health to a public health, and he took that conscious decision to serve larger and mentor a new generation of scientists and doctors in the country. So how do you see, what are the one or two key things every doctor, besides his medical knowledge, should have to serve the country, serve the people better?
Well, the doctors have to be much better scientists in the broader sense of the term, of multidisciplinary learning and the ability to assimilate knowledge from several disciplines. But at the same time, they have to recognize that they have to be important members of team function, and the team dynamics are going to be very important. But ultimately, they also have to bring in, whether they're actually giving telemedicine consultancy or actually holding a patient's hand, they have to learn that care, concern, courtesy, and compassion are also important elements of a professional relationship. And therefore, the future doctor cannot be growing in a compartmentalized knowledge pool. They have to recognize that knowledge has to be gathered from multiple streams. They cannot also function as solo providers of care. They have to become important team members, but ultimately respect the patient and the community they're dealing with.
Wonderful. We will open for a question and answer session. We'll keep the question. My colleague Surabhi will help me. We'll keep the question short, Surabhi, and a couple of questions. And after that, I will do a quick rundown on your recommendations to the government about the future of healthcare. Surabhi, yes, please go ahead.
Thank you so much, everyone. What a wonderful panel discussion. And like I said earlier, that we've gone live on YouTube. So there are a few questions that have been posted on YouTube, and there are a few of them that have been posted here. So let me just take a few of them here. All right, so the first one here is, does India lack capacity and training infrastructure in the likes of public health epidemiology?
Dr. Reddy, you want to go ahead?
Yes, it does. And that is where we need to really address the shortages. And that will not only come from medical colleges, it will come from other disciplines as well. And therefore, universities also have to play a much bigger role. For several years, they have shied away from looking at public health as a discipline. Now they need to address that as well. Because public health is actually a broad church. It brings in multiple disciplines together. And therefore, we need epidemiology, of course, there is no doubt about it, is at the center of much of that. But there are many other things like social sciences, health economics, communication sciences, all the social and behavioral sciences, quantitative sciences like demography. All of them will have to really come together in a meaningful manner to build our public health expertise. And the more institutions that are capable of delivering this, the better.
Thank you so much, Dr. Reddy. I think that answers a lot of other questions that have been posted on public health. There is another one on data which says, does India need a national level health data policy? Do you see the administration taking the inputs of the tech industry on consolidating this?
So, Joy, you want to quickly chip in?
I think we are already working on it. The data privacy bill that we have in 2018, which is very akin to what we have as HIPAA or GDPR, particularly in healthcare, is already coming up. So there are frameworks that are being developed, and very soon they would be in practice. However, it is also very important, and there's one more question that I just saw on cybersecurity associated with healthcare. One of the things is this, that how you internally fix your own systems is going to be very, very important from the kind of the phishing or the other attacks that comes from healthcare, or the threat that comes from healthcare data.
Yes, Surabhi. Yeah.
All right, so there's another one. Dr. Reddy and Dr. Jamil, how do you recommend we accelerate vaccinations? India can't seem to reach the required levels to achieve vaccination targets.
Shai Jamil, you go ahead. Your microphone, sir, is yes.
I just typed the answer in the box, and basically the way I look at it, India has the capacity to deliver enough doses to people. And we did that on 21st of June when we gave more than 9 million doses on just one day. So we have the capacity. It's a no-brainer that is the supply that's an issue. And there are various reasons for it, but there is hope that over the next few weeks, supply will get back on track. And I think part of the problem is that of the two vaccines that India depends on, Covishield and Covaxin, Covaxin has a very cumbersome manufacturing pipeline. The virus has to be manufactured in very large numbers. And this is a biosafety level 3 virus. So it needs special facilities. So, I'm told that one cycle of vaccine manufacture takes 4 months. So that I think is part of the problem. But hopefully we will sort it out as more vaccines come in the supply chain.
Dr. Reddy, you want to make a quick note?
Well, I think as far as the supply chain issues are concerned, Professor Jamil has already answered. I believe, at least even if we are having difficulty in scaling up our inactivated virus vaccines, the protein subunit vaccines should be easier for us because we have a fair amount of experience in that. But the other end of the spectrum is reducing the vaccine confidence issues, the vaccine resistance issues, building vaccine confidence. And that is where in the smaller towns and in the villages, we need to really ensure that the demand also is going to rise as the supply issues are being sorted out.
Wonderful. Surbhi.
Thank you so much. I think there is one question, and I know Dr. Rodrigo has been raising his hand. All right. All right. So this one question here, and then before we conclude, artificial intelligence in healthcare, are we in the hype curve? Shouldn't we be more pragmatic or cautious?
Yasmin, you go first, then I will ask Mr. Kumar to make a comment as well.
You'll have to repeat it. I missed that one.
So Surbhi's question was the role of artificial intelligence in the future of healthcare. Is it overhyped, or you see as a person on the ground that no, it will work?
I think for someone who's not that used to artificial intelligence, the part I do understand is that we cannot afford to be blindsided on it. We do have to look at all technologies and all options. The issue is how we're creating, what are the algorithms that we are creating, and are they really addressing issues of equity, and are they based on the evidence? So it's really important that we work together, that the data and technology experts and the technical experts work together to have the right algorithms in place.
Wonderful. Mr. Kumar, you want to say a word about it? The role of art, how do you see it?
I see that it is going to be a mandatory thing probably in next 5 to 8 years time, with a very low percentage of population maintaining medical records. Forget medical history. Probably the last visit prescription also may not be taken to the next visit for the doctor.
So
now it is going to.
Yes, sorry. So go ahead. Yeah, go ahead.
I just have 2 words. One is explainable, which is from the tech side, and the other one is the trust, which is from the doctor's side for adoption. If these 2 things are meeting, it will happen.
Wonderful. I think
and the privacy issue, most important.
Yes. Oh, yes.
Wonderful. I will go to Dr. Orphan. He wanted to make a point, and then I will come back for a quick one round.
No, I was just wanting to make a point on training human resources. The world is changing, so it also has to change. But I think I agree with Yasmin that we should not, with all the technology that we can learn, much easier. The human side. I was trained in a very old school manner that after I finish my history, I should have narrowed it down to 2 or 3 differential diagnoses, and I'm almost 80% correct, and I just use lab tests to confirm. Now it's different. People just go through that history for something to file, and it's get the labs done so that we get this sorted out. Now, it has to be probably using different types of technologies for learning. Several platforms, whether it can be a self-learning part, then you will have mentorship. You can even have Zoom among students. Probably it's happening now. Medicine is very difficult to turn into something virtual in terms of learning. It's really about people. And so also the testing. How do you evaluate students this way? But I guess eventually for public health also, that was another issue. How do you train public health experts? There's a big scope for this. And using telelearning. If we are able to, so if the issue is inequity in terms of the digital divide, is another area that this pandemic has shown us that probably in districts you can have, it's an old model in the 90s. It's a community telecenter. In the morning, it can be used for, let's say, farmers trading their goods. In the afternoon, it can be for teachers. In the evening, it can be for clinics. This was an old model in the 90s. I used to work in this space of open learning because I come from a country which is an archipelago. And it's difficult to reach. Yeah. So technology can be used to have a common level playing field and solve inequities. I guess that's where I wanted to.
Wonderful, Dr. Orphan, thank you so much for this intervention. Let me move to the final quick phase. I will ask each one of you, because we are really taking note of this, and we're going to share these recommendations with different stakeholders. If I ask each one of you to make one quick recommendation based on your vision for the health of, okay, if we leave COVID for the moment and think of really beyond now COVID, what is the one thing you will really recommend to the Health Minister of India or to the state governments that they should do to improve the healthcare, to improve the public health, medical education, use of data in the future? Dr. Shinatadi, with you first.
Well, as I said, primary healthcare-led universal health coverage, which incorporates all the elements that we have spoken of today. But that is where we can clearly demonstrate its impact.
Wonderful. Dr. Yasmin.
Ditto. I'm just going to echo that.
Wonderful. Okay, so Joy, with data, what is your key recommendation to the Health Minister of India?
I think data without internet access is not going to make much of a difference. One of the very important things is this: to get to the last mile, we need to ensure that what the Broadband Commission said, we need to take the internet to every possible corner of the country. Rest will follow.
Dr. Shahid, what is your recommendation for the government? It's going to be.
Yeah, I would say data is important, but so is data transparency. The ability to share data with different stakeholders. You know, all the wisdom to analyze data doesn't lie with the government. In fact, very little wisdom lies with the government. It's outside. And this is something that we have seen in COVID times. There is so much granular data available with ICMR and Ministry of Health, and despite representations from over 800 scientists to share that data, it has not happened. The country is at a loss. The public health system is at a loss. And my second recommendation is, for the future, be proactive. Don't always be reactive, and prepare for that. Invest in that. Invest both with people, invest in people, and invest funds into the system.
Thank you so much. Anjali, if it come to you. Your microphone, Anjali, is on. Yeah, your microphone, sir. Yeah.
Yes. Integrate health equity considerations into all policies and programs, and do not just collaborate within the health sectors, but with other important relevant sectors as well.
Mr. Kumar, what will be your recommendation to the governments or to the health ministers?
Building the basic health infrastructure at a very fast pace, simultaneously adopting advanced technologies for improving the effectiveness.
Thank you. Dr. Orphan, if I ask you, what is your a recommendation moving forward?
I think I'll bring all your recommendations to the table. But at the best summary is actually, as what I said in the opening, it's universal health coverage that Dr. Srinath Reddy through a primary healthcare strengthening approach. And if you wanted to do it fast, use what is existing. Don't as I said, some of these platforms for big data surveillance is already there. Scale it up, bring it down to local level. So I think that's.
I'm really so glad. I can see each one of you. You know each other. You have a vision, which is a shared vision for the better healthcare and better research and medical research. I'm so glad actually that we had this conversation. I know you all are extremely busy, but despite of that, you made time for this. We're going to make this short video public. So we will share it with a lot of people, medical colleges, young scientists, young doctors, and we will keep this conversation going. We're having 6 more summits in different states. We're moving to the next one in Karnataka in next month. But I thank you all for taking time and really joining this important discussion. And on behalf of my team, on behalf of our partners from YASH and SAP, I thank all our partners for your time, for sharing your thoughts and vision with us.